Hi everybody, I'm Dr. Jas, a sports physiotherapist. So we have this special session for our patients, and we are getting constantly so many questions regarding ACL reconstruction rehabilitation. How should we go? How much time it will take to heal? And is it a painful surgery? So many questions. So I'm just going to check with all my questions which I'm getting here. So the question number one, which was showing how long is rehab for ACL. So our full recovery takes time, and patients should you have to keep patience, and it takes time, right? And minimum like from you have to avoid if you want to avoid stick and crunch, at least minimum 2 months, and maximum you can go to 9 months. Depends how your rehab is going, right? So there is no fixed protocol. Okay, we will fix this patient this much of time, this much, because it all depends. All the research which is in the market, which is in the journals, it always depends on the geographical basis. Since we are in India, so research should be Asian side or Indian side. For example, somebody stays in the America and they have published any research about ACL. Since the research which is over there, they have researched on the ACL patient which stays over there only. So if we cannot take that research, yes, we can take some references from there, but we cannot 100% say yes we have to follow that protocol only. We have to follow here Asian protocol, Indian protocol, because we have to check our geographical, because our gene is different, their gene is different, right? So it depends on that. Their body structure is different, our body structure is almost different. So these are the basic stuff which we have to keep in mind while we focus on the protocols, right? So there are 5 protocols of ACL. Let us start with the day one, from the day of surgery. Before going for ACL reconstruction, I must tell you what we should do. We should, because this is the elective surgery, it is not like life-threatening condition. You can choose your day of surgery. Before that, I must tell you, you should go for a proper strengthening training, so that recovery will be shorter. If you focus on your strengthening, and your physiotherapist will help you to achieve that goal, so that will be good for you. At least a month is good. If you focus on the rehabilitation properly, then you can choose the day for the surgery. Once surgery will be done, normally as per the research and all, it takes only 24 to 48 hours to muscle get deactivated VMO. If we keep straight, because we have to use a knee support for the limb, we have to keep it straight for at least 1 day or 2 days, so it gets deactivated. So we have to work hard again for that muscle. So let us start the questions. What are the phases of ACL rehab? Which, as I am getting this question, the first phase one is recovery, and surgery is always. We have to go through surgery. Then we will use the cold pack. We will use some exercises which will help you just minimize small exercise, kind of a minimum movements we have to do, like 5 degree, 10 degree movements, and then we have to strengthening for the glutes. We use isometric exercises, right? Then the second phase is strengthening and neuromuscular control, in which phase we focus fully on the knee, and we tell our patient to get up, stand on, just put weight on this leg, barefoot, and just achieve that goal, neuromuscular stabilization. Then third is running, agility, and landing. That is very important. For example, if you are a sports, you are an athlete, you have to achieve this goal, right? Because they have to go to return to sports. Before that, they should achieve this level. Actually, they should know, agility is very important. Since if you can't do agility test, if you cannot, go through that agility, you may injure your leg again. I mean, ACL will get that will get relapsed. Okay. So next is, once we achieve this goal, then we go to sports specific exercises, that is called return to sports phase in which, for example, somebody is a cricketer. He has to drill some, kind of running in between the wickets, like fielding type, right? If you're a bowler, just with a minimum pace and short run up, he has to bowl. If he is a bowler, like a footballer has to drill, right? He uses ladders, he has to go right, left, front, back, all these things. Then next is prevention and re-injury. Then that is this is a very important phase of a sports player in which he has to go beyond that level. Once he achieves the return to sports level, he has to do train very hard for this level so that he will not get injured again. That is the highest level, right? So next question is, what helps ACL heal faster? So simply, ACL is faster by the help of a physiotherapist who will use some modalities. Cryotherapy will use bracing, should be there, rest, elevation, and sometime compressions can be done, and he will achieve that goal within a frame of a time what as per the advice of his surgeon and his based on his experience, right? The next question is, can you rehabilitate a torn ACL? See, we can rehabilitate knee, but not ACL. If once it is a grade 3 torn, we cannot do anything for it. We can just strengthen and stability. We can try to stabilize your knee. We will work on the stability. We will work on the strengthening exercise of a knee. But if it is a grade 3, you have to go through a surgery. There is no other way. Another question which we are getting: will my knee ever be the same after ACL surgery? Yes, yes, you will be the same, but it again depends on your exercises, rehabilitation, and your patience. If you follow the proper protocol, your physiotherapist will help you definitely achieve 100%. What is the fastest ACL recovery time? See, it is a debatable topic. Some people say it takes 6 months, some says 8 months, some 9 months. So, and some people says 1 year exactly to return to sports. When should we return? For example, if somebody is saying yes, I am fit after 6 months, but sometime it relapses again. If he earlier in early stage, he will go for sports again. So what he has to do, he has to still go for strengthening and go for small drills of his specific sports. So as per our advice, expert advice, that is in our knowledge, maybe we might be wrong because we have seen so many ACL rehabilitation cases. It depends, as I said earlier, it depends on the geographical basis and it depends on the sports and the person and everything. How old was that ACL case? How rehabilitation was going? So I'll take minimum call to 6, nothing 6. I mean 8 months minimum, 8 to 9 months. Okay. Then another question is, what can we not do with ACL rehabilitation? It depends on the where we have taken the graft. That is very important. On which, if some some surgeons take graft from the hamstring side, some takes from the gracilis, from the calf side. So you have to be careful on that area for first few 4 weeks. Then you can do everything. Then another question is, cycling good for ACL tear? See, ACL, uh, I mean, is it after, if it is a question is ACL reconstruction rehabilitation, then yes, you can do after you achieve your full range of motion. But if it is just a tear, then still you can do exercises, but seat should be, that seat should be a little high, so that you will not bend your knee. I mean, more than 90 degree, because nothing will happen to, if you still keep low, still there will nothing will happen to your ACL, because there the mechanism of injury is very different, where in which we plant our foot is planted and we suddenly there is a rotation of a femur bone. So there should be, I don't think there should be any issue. How can I fix my ACL naturally? If this is a grade 3, you cannot fix it yourself naturally. You have to go through a surgery. This is simple, straightforward answer. Yes, if it is a grade 1 and you are not playing any sports, you can go for what you can do in early stage. That icing, now there's another product that is called Love and Passion, in which we even don't use ice as well. But still, what that old traditional way was, we use ice, rest, elevation, compression. These was the old tradition. Now the new technique that is called love and passion, in which we don't use ice, we don't give rest to a patient. We give rest as the patient's comfort. If patient is able to get up and he can put weight, if he's able to put weight only 5%, he can put 5%. If he can put 10% weight, he can put 10%, not more than that. So it depends, so that we want the body to heal itself. But definitely here we are not healing your ACL, but we are just relieving your pain and swelling, all which normally takes 10 to 15 days. And if you are not sports player, you are not help you definitely. Is it continue? I am sorry in between the interruption. So at least you can do some exercises 20-30 minutes, so that you can achieve your strengthening. But ultimately there is a ACL grade 1 or grade 2 is still there. If you are doing any activity in which sports is involved, definitely it will get grade 3, then you have to go for a surgery. And with time, it can some any day it may get teared, or if not teared, but muscles may get weak, you may get feared, you may get scared. I cannot jump, I cannot walk fast. So then you can't do any high intensity activity, or you cannot run or anything like that. That may hurt your knee in future. Is massage good for your ACL injury? No, in once in acute stage you cannot do massage, because there will be swelling. You cannot do massage, but what you can do, you can do compressions. That will help you. But massage in early stage you cannot do. In later stage you can do. There is nothing wrong. Can ACL heal? Which I have answered. Can ACL be healed without surgery? No. If it is a grade 3, it won't heal itself. Can you lift weights with a torn ACL? See, you cannot. You can lift it, but if you are in a particular position, you are not. You are in a static position. If you are in a dynamic, maybe you can hurt yourself. But if you are in a static, you can lift. But make sure, if your knee is buckling or something, if something is happening, you are doing some activity in a which is there's a rotation involved in that movement, then you should avoid lifting weights. How do I strengthen my knee after ACL tear? You should follow your physiotherapist's advice and your surgeon's advice. They must know the better. So they will work on your glutes. You should work on your core. You should your hamstring muscles. VMO is very important, and your calf, right? And then finally, this is 3 to 4 weeks minimum protocol. First, in this, what you can do first, if you are not going to check with the physiotherapist, at least what you do yourself, do strengthening for your quadriceps, VMO, hamstring, and glutes minimum. Then you can add on with the core strengthening as well. Okay. Next question is, what does ACL rehab takes? Why does ACL rehab take so long? See, there is a difference between tendon and a muscle. You must understand. See, tendon has a very poor blood supply as compared to muscle. So it takes definitely time, and you have to be very patient. If you want to get fit, you want to return to sports, you should focus on it. How long after ACL surgery can you walk normally? It normally depends on the rehabilitation and the patient and all, but minimum 2 to 4 weeks. And after if you expect like a brisk walk and all, at least you can do it at least after 10 to 12 weeks. Okay. Another question is, when can I sleep without brace after surgery? Once you achieve full range of motion, right? For full range of which you will receive, achieve 4 to 6 weeks, then you can, and you can keep a pillow if you still want to, we use ACL brace with the ROM, in which we control your range of motion. Whenever we want to increase 10 degree, 20 degree, 30 degree, you can fix it, and you can sleep with it in, and you can pillow in between your knees. How do you know if your ACL is healed? See, once surgery is done, then definitely there is no question, it is not healed. It will get healed with time, and it becomes 6 months, 4 months, 3 months. It will get healed. But if you want to sure if something has misfortune happened, now you want to know is there any chance you have hurt your ACL again or relapsed again, then you have to go for an MRI. And physiotherapy, your surgeon will also do some test manually. They'll also check. So 90% chances there is nothing wrong. Go after once the surgeon do surgery, they do very good surgery all the time. But if you are hurting yourself, you are doing some activities which you should not do, then you may hurt. Make sure you follow the instructions of your surgeon and physiotherapist. Okay, this is very important question here. What's worse, meniscus or ACL tear? See, ACL is something different and meniscus is something different. Meniscus is in between the joint, which works like as a cushion, or you can say as like a shocker of a car. And ACL is limiting your range of motion, that directions, right? These are two different terms. But once you tear your ACL, there is always a chance you are injuring your ACL, meniscus as well. So once you go for MRI and you have done, they definitely will see a torn meniscus as well. Okay, another question is, can I climb stairs after ACL surgery? Definitely you can. Once you achieve your range, once the physiotherapist will check, yes, you can. At least you have to reach at that level. It may take 4 to 6 weeks. You can do before than that, but you should at least put, if you can put weight on that leg, then only. Because physiotherapist will decide, your surgeon will decide when you are able to put full weight on that leg, right? Then you can. Okay, another question is, what food is good for ACL? For example, lot of fresh proteins, oily fish, lean white meat, extra fruit and vegetables rather than sugary fat and pro-inflammatory foods. I mean, simply you have enough proteins, green vegetable, fiber rich. Avoid sugar and all, because you may put weight, because you are not doing anything. You are sitting at home, ideal. You are not moving so frequent or anything. So avoid sugar contents. Can I live without ACL surgery? Definitely. This surgery is not anything life-threatening condition. You can live without ACL surgery, but in future, with the age, you may get arthritis chances, because we have a limitation of range. Once there's a ACL, torn ACL, the range has increased. So it may hurt your meniscus, it may hurt your chondral area of your that tibia and fibula. Is stretching good for torn ACL? This is the other question I got. Stretching that benefits for ACL, including long string wrap for towel around your. See, this question I can answer like this way. You are not stretching actually ACL. You are stretching hamstring. If you are, taking a towel, then trying to stretch your foot yourself and lifting it, you are stretching hamstring. You are not stretching the ACL. ACL is in between. You are not stretching that. What is the fastest ACL recovery time? Even I told you 6 to 8 months is enough. You can achieve, but you can achieve earlier than that. But you must avoid. You must avoid return sports. You should be make sure, and your physiotherapist make sure you are good. Can you still exercise without torn AC? Yes, you can, but you have to avoid activities which I told you earlier, in which there is a rotational movements. But definitely you will hurt. How can I fix my ACL naturally? You cannot fix ACL injury naturally. What triggers ACL? ACL triggers, there is a mechanism that you are in rhythm, you are running, and suddenly you are doing some movement on your, for example, if you are on your right knee got injured, how it happens? Because you are running so fast, suddenly you are taking right turn and your foot is planted at a point and you are not able to move your foot, and knee got rotated from the femur and you got torn that thing. What does ACL rehab? So long as I told you, you have to keep patience. It depends on your surgeon, it depends on your physiotherapist, it depends on you how you are doing the exercises. Will my knee ever be the same? Yes, it will be same. You should focus. Okay, what is the fastest? As I answer you, is compression good? In the later, in early stage, you should avoid because in early stage, surgeon has already wrapped you so many stuff. The stitching is there are the some staples where stitching is there. Once it will be removed and there is no scar and all, you can do some compressions. There is a flossing which we do that will help you to reduce your swelling as well. But anyway, swelling is nothing wrong. It is a protective protection for your knee, which is protecting. But with time, this will go off within 4 months, 5 months, 6 months. But still, if you want, you can go for flossing, or we use some high-end techniques that blood flow restrictions we do, in which we train for a patient. We stop the circulation from the hamstring area, and then we do some exercise in advanced stage. With the help of that, we achieve strengthening faster than normal. That's called a blood flow restriction techniques. I hope you don't have any other question related to this. Surgery is always the option, as I told you. I'll check with my camera if there is any question. uh, I think we have answered almost every. How do I make my ACL ligament stronger? See, ACL is itself very strong. What you can do, with the ACL, how it becomes strong? Just strengthening your knee, make it more stable. Once it will become more stable, it will get strengthening. I have a question, that is Shahid Sultan. MRF is helpful or not? MRF. See, in early stage you cannot do. In later stage you can do. That will be definitely helpful to reduce the muscle tightness and all. But in early stage one we cannot do. Avoid for at least first 2 to 3 weeks. Thanks for your question, Mr. Shahid Sultan. Uh, I thank you to all to watching my this video, and we normally make a live session every Tuesday or Monday or Tuesday. We try to be on this schedule every Monday and Tuesday around in between 6:30 or 8 in between we make video. Thanks for watching. Thank you.